First News with Keeler in the morning on WIBX and WIBX950.com.
Swimsuit? Check. Sunscreen? Check. Phone charger? Check. Don't forget to pack the 5-Hour Energy. It fits great in a pocket or carry-on, and the alert feeling will help you arrive ready for anything. Now get 20% off when you use code 5HETRAVEL at 5hourenergy.com. Expires April 30th. One-time use only. Not valid with other discounts. Remember, visit 5hourenergy.com and use code 5HETRAVEL to save 20%.
Dr. Kent Hall standing by on the line right now. Doc, good morning.
How are you doing this morning?
Good. I'll ask you, and I know we only have a couple minutes with you this morning, but I will ask you here on the vaccine. Do you have a problem with cruise lines requiring the vaccine, or with colleges, which is the requirement, and that's a done deal, by the way, with colleges requiring the vaccine to get people back in the classroom?
No, I don't, actually. I mean, again, as we mentioned this a little bit last week, that, the vaccine is not 100%, but basically if you have a population of patients or a population of people, all of whom have been vaccinated, then you've basically achieved herd immunity within that population, because 95% of them are going to be protected, and herd immunity we get with 80 to 85%. So, even if somebody does contract the vaccine or the disease, if they have it when they come on board or whatever, it's not going to spread throughout the entire cruise ship or throughout the entire dormitory if you're talking about colleges. So, and I think you're right. I think nothing denigrating about cruises. I've taken many of them and I've enjoyed all of them. But they are incubators for diseases, and you've got a lot of people in an enclosed space that are sharing, eating and entertainment areas, and it's just ripe for any kind of a transmissible disease. So, no, I think it's the right thing to do in order to protect that for people.
And think about it. Stores are saying if you want to come into our store, you have to be vaccinated. Otherwise, you can come into our store, but you have to wear a mask. Is there someone out there saying that's not fair? Why are you? But there's I guess
no enforcement.
There's no enforcement, though. Yeah, that's a good point. You can do whatever you want to do. And then we had someone just a minute ago talk about why he feels this shot is different. Number one, it's because it is not yet approved by the FDA. Although, didn't one of them get approved? And then the other part is that 4,000 plus people have died from the vaccine. Is that true?
So I haven't heard a number of 4,000 dying from the vaccine. I will have to investigate that and see where that number comes from.
Okay.
But I would say that that the safety of this vaccine, given the fact that it's been given to literally hundreds of millions of people across the world, the safety of these vaccines is pretty well set. I mean, are they 100% safe? Is it that you will never have any kind of an adverse event that will even become a significant one? No, because nothing is 100%.
Right.
But they are very safe in very large numbers. So let's say that the 4,000 is the right number. So if it's 4,000 people that have died of some reaction to the vaccine, and please don't say that I'm saying that because I just don't know.
Right.
Okay. But and it's been given to hundreds of millions of people. The incidence of death related to the vaccine, relative to the incidence of death related to the virus, is phenomenally small. So,
Doc, and the numbers continue to be relatively low. Is that correct?
Oh, yeah, the numbers are fantastic. I will tell you that as of this morning, I actually got the numbers for this morning, and we have 6 people within the health system that are positive. So that's as low as we've been since last September.
Yep. So. I believe there was one day you were either at 0 or 1 on September 1st, but single digits is something we have not seen in a long time in the hospital. So good numbers. All right, Doc, we'll do it again, I believe tomorrow. I don't know. Andrew's setting all that up, but thank you so much.
Thank you, everybody. Please be safe.
You do the same. Thanks.
Have a great day.